As TriWest Healthcare Alliance's co-founder, president, and chief executive officer, our next guest has spent his career working to ensure that America's veterans have access to high-quality health care no matter where they reside. With more than 30 years of experience, success, and accomplishments in national healthcare policy development, David McIntyre's knowledge and passion have helped to establish TriWest's network of more than 1 million providers for veterans across the nation. Based in Phoenix, Arizona, TriWest is one of the 2 third-party administrators actively overseeing the implementation of the new Veterans Community Care Program, part of the Mission Act. After expanding services in 2018, TriWest now serves veterans in all 50 states, as well as American Samoa, Guam, Northern Mariana Islands, Puerto Rico, and the Virgin Islands. Ladies and gentlemen, please give a warm welcome to TriWest Healthcare Alliance President and CEO, David McIntyre.
Commander Lawrence, thanks for that warm introduction. Adjutant General Jones, Quartermaster General Anderson, Auxiliary President Kriebel, Executive Director, and my good friend Bob Wallace, ladies and gentlemen, thanks for allowing me back. I was in Kansas City at your convention last year, and I heard Jerry Moran talk about what drives and motivates him as a U.S. Senator to lean forward for those who serve. I then found myself about 2 or 3 months later sitting across the table with Senator Moran as he and this organization were trying to figure out how they were going to take the Mission Act over the finish line. And together, you did it. And it's our awesome privilege to update you on where we are since that period. And it's an honor for me to be here to honor one of my good friends today. As Commander Lawrence said, we serve the whole nation. When I was here last year in Kansas City, when I was at your convention in Kansas City, we did not serve the entire nation at that point in time. Our colleague contractor was relieved of their responsibilities, and we were asked to stretch ourselves to finish the job and make sure that while we're bringing on telehealth and doing other things, that doctors all over America had the opportunity and the privilege to lean forward and do what they want to do, and that's support VA in delivering services for our nation's heroes. We started the work together with VA on September 11th and evaluated over the course of 2 days what it would take to accomplish that climb. We chose together December 7th to start the rollout. The first state was in Montana. We finished that work on January 31st of this year, December 7th to January 31st. There's now 1.1 million providers in America leaning it forward at the side of the VA to make sure that veterans get what they need, what they deserve, and what they've earned when it's needed in support of VA. And we made a commitment to them. We said, we'll process and pay your bills on behalf of VA in 10 days. And that's exactly what we're doing. And 12 banking institutions in this country have come along our side and said, how much access to capital do you need? Because we want to be part of what you're currently doing. So we have the capital and we're paying our bills. The second thing that we're in the process of working on right now is finishing the development of an urgent care network that's available in communities across the country. One of the objectives of the Mission Act was to make it possible on a Friday night to go to an urgent care center if you have a sinus infection. Or if you cut your hand, as I did as a kid, you could go in and get 3 stitches rather than going to the emergency room and waiting for several hours because you're not there with your arm cut off, so they're having to triage you. Today, as I stand here, 86% of this nation's veterans eligible for urgent care have to drive no more than 30 minutes from their house. I committed to government personally that I would make sure myself that that job got done. I flew in last night to honor my friend this morning. I will leave in a couple of hours. I will go back to leading my team and getting that job done. In 3 weeks, we will have finished our work. In 3 weeks, 92% of this nation's veterans will have access to urgent care within 30 minutes of where they live, and that is all over this country. That's in Puerto Rico, that's in Guam, that's in the Virgin Islands, that's in Samoa, that's in Hawaii. That is what was intended. If it doesn't exist, we can't contract with it. But at the end of the day, Medicare requires 70%. We said we need to make sure that there's footprint everywhere where footprint exists, so that we can make sure that together we, Congress, the White House, and the VA leaned forward and made it possible for the arc of access to change in that critical space. We've had over 10,000 encounters now occur in that system. The complaints are less than 0.01%. And we're using the opportunity to figure out what they are, to find the gaps, fix the gaps, and make sure that it's going to be strong. So it's our incredible privilege at TriWest to lean forward for a while. We're looking forward to the day when we don't have to worry about every zip code and almost every time zone in the world, because that's what we cover right now. We're looking forward to the day when we have a colleague that will be at our side, that will be doing the rest of the country. And indeed, they start their work late this week in 2 parts of this country as they climb up to the table and we step back with a 30-day overlap designed to make sure that there is no gap for veterans and that there are, to the best of our ability, no gap for providers, because that's the commitment that we made once we settled this down. No one, no organization has leaned forward more smartly on this topic and more focused and more aggressive than the VFW. And at the end of the day, yes, you should give yourselves a hand. I said last year, we're not here to privatize the VA, and we're not. We're simply privileged to do the work we do every day in support of the country at the side of VA. Most of us are either veterans or veteran family members, and we consider this work to be an awesome honor and a privilege. I'd like to thank the VFW for the amazing work that you've done, for the way in which you represent those who've served this country, and the way in which you push those of us that need to continue to stay focused. And I want to thank you for entrusting us with the opportunity to work at the side of the great providers in VA to be able to deliver services. I'd now like to show you a video that's going to be part of a thank you campaign that will end on Veterans Day. That is about allowing veterans to have voice in thanking providers for caring for them, both providers in the VA and providers in the community. Because when we leave the whole country, we want to make sure that we've enabled the opportunity to say thank you and to help everybody understand it's about a care team. It's not about one or the other. And the rhetoric needs to change because all are needed in order to be able to serve the great people that have served this country. So if you could roll the video.
You know what a definition of a veteran is? We sign that blank check, and that blank check is payable up into our lives. That's what a veteran is.
We are a big brotherhood and sisterhood now. We will always be there for one another, no matter how difficult it may be.
War is not like watching TV. It's real. It changes you. You don't come back the same. Nobody comes back the same.
I would definitely say that the VA saved my life, because when I left active duty, I was really critical. And coming to the VA, I started seeing many specialists, the team of providers, both in the VA and the community care providers. They are doing the best to keep me as healthy as I possibly can be.
With the community care, with the providers coming forward, we're able to save, we're able to help the veteran, provide a quality of life, and actually probably save some lives.
I would say to my VA providers, thank you. I mean, because I was considered polytrauma with all the things going on, my lupus and my PTSD, they worked well together and they were a team, and that made a big difference to me.
And I know that those physicians that are out there willing to help the veteran, that they're part of our family. You know, they may not have been in the active military, but they are part of the military veteran family. We go to them when we need their help. We cry on their shoulder when we need to. And I guess it's love. That's what it is. Simple as that.
I'd like to ask my friend Bob Wallace, your executive director, if he'd come up and join me on the stage. And while he walks up, I want to tell you that Chuck Byers, who started that video, had prostate cancer. Chuck Byers is alive today because of the healthcare delivery system that's VA. Chuck Byers is alive today because, along with 3,300 veterans who had prostate cancer in Phoenix, Arizona, with no urologist in the Phoenix VA at the time of the crisis, was on a list. Chuck Byers was taken care of by one of the 67 urologists in Phoenix, Arizona, that leaned forward in 6 weeks and took care of all 3,300 of their heroes. That's what this is about. As I said, I had the privilege of coming in last night. I apologize for not staying long, but I wanted to take the opportunity to come here to say thanks to my good friend Bob. Bob's a person who I hold as a hero in my own life for his own service. He's also a person who I hold as a hero for standing tall when standing tall is not easy. Although for Bob, it's probably pretty easy because he is tall, right? But the bottom line is there's no one that I've encountered in my 35 years of this privileged work. First, a decade as a staffer on Capitol Hill, and then almost 25 years now serving in the role I'm privileged to serve in, both taking care of those in the military family and now in the veteran community, where I like to say, you're not a veteran unless you were birthed in boot camp. There's no one that stood taller, kept everybody more focused, been more honest, and put the thumb down on those of us that needed focus. Whether you're in a role I'm in, whether you're a member of Congress, whether you're the President of the United States, or whether you're a Secretary of VA, your organization has been incredibly well served by the likes of Bob Wallace. And Bob, I think you'd probably agree that once in a while those words have to be very sharp and focused, and they have been, but they've been the starting point for a very mature conversation that's always led to the right thing for veterans. And I personally want to thank you for that. As I think about the fabric of the VSO community and I think about this great organization, I think about the loss of someone like Bob Wallace to the fabric of what goes on. But I know Bob well enough to know that he would say, there are people that are right behind me that are ready to climb into my shoes. Now, his are big shoes, so they're going to be really hard to climb into. But I think he would say, and you would all agree, that there's amazing people that will follow, that will fill that role the best they're able when they get to that place. So Bob, in honor of your service, in honor of all of you that you've done to keep all of us honest, and your effective leadership. I would like to let you know that on behalf of the VFW, we're going to be making a $50,000 contribution to the VFW SVA Fellowship Program so that the next generation might be effectively trained. Thank you, Major. No.